Hello, my name is Dr. Patrick Maloney. I'm a chiropractic physician here in Phoenix, Arizona. Welcome to Maloney Chiropractic. Thanks for tuning in. So today I wanted to talk about a syndrome that presents into the office commonly, typically after some sort of trauma. And this is a patient who's experiencing neck pain, along with shoulder pain, some pain here in the upper back near the scapula, and then also oftentimes moving up and creating headaches. So all of these problems present usually together in many of our patients that have been traumatized either in a car accident or sports injury or some other such issue. So after examining the patient and making sure that there are no contraindications to treatment, typically we'll order some x-rays. Once we get those x-rays back, we'll review those very carefully. And what we're looking for on x-rays is to make sure that we're assessing alignment, any kind of degenerative changes that might already be in there, and also any surprises, any contraindications to treatment. Once we determine that we can proceed forward with the patient, we'll be addressing the main issue, which we've identified in the exam as being a misalignment in the neck area, where the nerves have pressure, or they're being pressured, and they are causing pain locally and also into the shoulder area. These nerves travel into the arm, they travel into the upper back, and they also travel upwards into the head. So that can cause neck pain, shoulder, upper back pain near the shoulder blade, and then also headaches. So in a few minutes, we'll be demonstrating how we would normally treat that here in the office. Welcome back. I'm Dr. Maloney here at Maloney Chiropractic Clinic. And I wanted to demonstrate a treatment that we would normally give a patient who's been struggling with neck pain that's shooting out into the shoulder, into the trapezius area, or the trap area, and also traveling down next to the shoulder blade. In this particular case also, we're having some issues with headaches. So it's headaches, neck pain, shoulder, and upper back problems, and it's all together. And so after focusing on the treatment, Anna's had some x-rays done in the past to make sure that we were not dealing with anything that was a contraindication to treatment, and she's responded and benefited greatly from chiropractic adjustments. So each time the patient comes in, or each time Anna comes in, we will be evaluating the neck area that we're treating. In this particular case, we're treating the upper to mid neck area, and we'll be adjusting that, as well as some segments in her upper back that are contributing to the shoulder problem. All right, so for that, what we're going to do is we're going to go face up. Lie on your back, please. And we would start there. I would also go ahead and scoot towards your feet. Fantastic. So raise the headpiece up, make it comfortable. Okay. So what we're going to do here is we're going to do a traditional chiropractic adjustment where the patient is lying on their back, arms crossed. We're going to have you just raise your head up a little bit, and then we're going to find the segment, in this case right in the upper back, and we're going to place our hand, and we're just going to drop right through that. Yeah. Very nice releases. Okay, good stuff. All right, fantastic. Our next step is we're going to be adjusting the neck area. Fantastic. There we go. Now in some cases we'll use different techniques, but in this particular case, this is the most effective technique for Anna's particular situations. Okay. And that was a beautiful thing. Okay, all right, there you go, one day closer. Okay. Now Anna also has exercises and stretches and dietary advice and other things like that she's been following, which is always going to be helpful in terms of healing and maintaining and promoting your health. All right, see you on the next one.